The hottest gaming craze is turning rehab into WeHab. It's just one of the innovative techniques helping patients recover at senior care centers. And Penny Jones is here with all of the details. Hi Penny, how are you?
I'm good, how are you?
This is fascinating to me. What is senior care centers all about?
Senior Care Centers is a healthcare provider for seniors. We range from inpatient rehab, which is our specialization, to assisted living, independent living. We have long-term nursing as well.
Okay, a little bit of everything, and you're helping everyone, and I love that whole concept of WeHab, and we'll get to that in just a little bit. But what is the rehabilitation therapy?
Rehabilitation is typically a patient that comes out of a hospital setting, mostly seniors that have gone through a debilitating stay, particularly stroke patients, hip fractures. That's the majority of what we see. They come into our facility for occupational, physical, or speech therapy.
Okay, well, so what type of patient would you likely see?
Like I said, stroke patients are a typical patient that would need therapy. We look at what their level is of function prior to coming to the facility, prior to their hospitalization for their surgical procedure, and then we set a plan of care for them, an individual plan of care.
An individual plan of care, which I'm sure that's the big buzzword, that's the specialty part, because everyone is certainly different when they come in, and some of them stay at your facilities, and some just come in for therapy sessions. Is that right?
Yes. The majority of the patients that we see do come from the post-acute hospital setting, so they come in for the therapy, and then a good 90% of them go home. We have a navigating home program where we get the patient rehabbed and back to their level prior to their hospitalization. They go back home to their normal setting.
Which is really nice.
Yes.
Okay, what are your facilities like when we take a look inside?
Well, we have state-of-the-art equipment in our rehab facilities. Each of our facilities has therapy department. Each of our facilities also has long-term care for patients that may not be able to go back home. Of course, our goal is with the patient to get them back home.
Yeah.
That's our ultimate goal.
And that's where they feel the best.
Exactly.
And probably rehabilitate the best too in their familiar surroundings.
Exactly. The thing about skilled nursing and therapy is that it is a more structured environment. Many people do want to go home straight from the hospital, of course.
Sure.
Physicians do recommend that they come in for skilled nursing for the therapy just because it gets them back to their prior level of function a little bit faster. There's medical supervision by skilled nurses and the therapist, so their outcome is usually better.
All right, let's talk about those innovative techniques that you help people get back to shape with. What are we talking about?
Well, one thing that we've done is we've purchased the Nintendo Wii game system in all of our facilities. And what that's done, of course, everybody comes in with a regimen for therapy, so they participate in therapy. It can be tedious, it can be painful sometimes. So we've incorporated on top of the normal regimen something that's kind of fun.
It looks like they're having some fun.
That's our therapist, and they enjoy it just as much as the patients. But the patients, you know, that may have played golf in their younger years, they'll use that motion for to increase their range of motion and strength and endurance, so they really enjoy it.
It's familiar movements for them. Why does this work so well?
Well, I think because it is tedious, therapy's tedious. Most elderly patients aren't used to an exercise program, and so they come in and they have to participate in this regimen of therapy that is tedious. And so it just kind of breaks up the monotony. It's not in place of the therapy, obviously, but it's a layering.
Sure, it's in conjunction with it. It looks like the therapists have a really good time implementing it. What's their feedback implementing the Wii?
They have said they get better participation from the residents. Some of them that want to come in and have therapy, it's kind of hard to motivate them to get out of that bed. Sure. They can say, let's go play golf, and they'll come in and enjoy that.
And I saw there was bowling up there too. What other activities? You have bowling, golf, tennis,
golf, yes.
So something for everyone when they're coming to rehab. That's really great. What are the benefits of going to your facilities rather than someplace else? Is it that great interaction and personalized service?
I think so. We are a mid-sized company. Some of our facilities are larger than others, but we do pride ourselves in being a home-like environment, and we also, like I said earlier, provide that individualized care. So we set up that program with the patients, and we include them in the team approach to getting back home.
So they have a say in kind of their treatment, so they don't feel like they're being talked at or they're being talked with, and maybe that's the home environment too, because they feel it's a safe place they can go in and feel good.
Yeah, and they set the goal with us. You know, they decide where they were before they came in and where they want to be when they leave. So they're a part of setting the goal, and then they decide when they're ready to go home.
And your goal is for them to not need you anymore, and that's when
Exactly.
you know you've done your job.
Exactly.
Really great information today, and WeHab, love that. Thank you, Penny, so much for
You're
joining
welcome.
us today. And for more information about Senior Care Center, log on to their website at seniorcarecentersltc.com.